Greetings, friends. Today, let's talk about dry mouth. Dry mouth has a medical synonym, xerostomia. We won't use this word anymore. It's just so you know that it means the same thing as dry mouth. So, dry mouth is a condition in which the salivary glands do not produce enough saliva to fulfill the main functions of saliva, participating in the digestion of food, moistening the tongue, and the mucous membranes of the oral cavity. In general, saliva performs a huge number of functions. It makes swallowing easier and keeps the mucous membranes functioning properly. That is, it supports the local immune system. It is involved in the digestion of food. It allows you to taste food. If there is a lack of saliva, this leads to very, very big problems. A deficiency of saliva, that is, a decrease in salivation, manifests not only as a feeling of dryness in the mouth, but also with other symptoms. Well, first of all, it can be bad breath, pain, difficulty chewing, swallowing, and speaking. Pain when swallowing, sore throat, hoarseness, and a distinct feeling of dryness on the tongue. Changes in the sense of taste, problems with wearing, for example, dental prostheses. What are the main causes of dry mouth? The most common cause is breathing through the mouth, which is caused by nasal congestion. Accordingly, allergies, a deviated nasal septum, adenoids, and even a simple acute respiratory viral infection can all lead to dry mouth. Next, dehydration. Well, it's clear that if the body is experiencing a lack of fluids, one of the symptoms of this deficiency will be dry mouth. In addition, dry mouth is a very common side effect of a huge number of medications. That is, dry mouth can occur when taking antihistamines, antidepressants, diuretics, painkillers used to treat high blood pressure, iron supplements, and many other medications. Certain physiological conditions can also cause dry mouth. First of all, your age. The older a person is, the worse, well, physiologically, the worse the salivary glands function. And many elderly people actually have a real deficiency of saliva. And by the way, it is precisely because of this that many elderly people have a diminished sense of taste. A less common cause of dry mouth is, for example, nerve injuries in the head and neck area, which can also lead to dry mouth. And you should also know that with certain illnesses, dry mouth is more the rule than the exception. For example, dry mouth occurs in diabetes as a consequence of a stroke, with oral thrush, a yeast infection in the mouth, with Alzheimer's disease, with certain autoimmune diseases, and with HIV or AIDS. There is even a condition called an autoimmune disease, Sjögren syndrome, which is characterized by dryness of the eyes and dryness of the mucous membranes in the mouth. Dry mouth can also occur with smoking, chewing tobacco, drinking alcohol, or using certain narcotic substances. In particular, dry mouth is relatively typical for marijuana and for the use of methamphetamines. Naturally, dry mouth can lead to certain complications. Well, the complications of dry mouth, for example, obviously include cavities and gum disease, ulcerative cracks in the corners of the mouth, problems with the tongue, problems with chewing and swallowing, oral thrush, and so on. And most importantly, it causes a very pronounced feeling of discomfort. Of course, a doctor will help you figure out the diagnosis. But I want to tell you right away that in 90% of cases, the cause of dry mouth is actually difficulty breathing through the nose. There are certain rules, universal rules, that allow you to respond properly and appropriately to dry mouth, at least until the doctor makes a specific diagnosis. So here are 8 rules for dealing with dry mouth. First, drink plenty of fluids to prevent dehydration. Second, use humidifiers, especially while sleeping. The optimal air humidity is between 40 and 60%. Third, keep the air in the bedroom cool. The optimal temperature in the bedroom is 16 to 20 degrees Celsius. 20 is already the maximum. Most reference books indicate 19.5 degrees. 4. Use special toothpastes or mouthwashes, especially those designed for sensitive mouths or gums that do not contain any alcohol. And let me say right away, look, if you go to any search engine and type in toothpaste for dry mouth, you'll see special toothpastes recommended. Gentle mouthwash for dry mouth. In general, all children's mouthwashes do not contain alcohol, and they are suitable. Next, the 5th point, pay attention to what you eat and drink. Alcohol, caffeine, sweets, all of these increase dry mouth. The 6th rule, analyze your medications. Can't do it yourself, go over them with your doctor. If dry mouth occurs after taking medications, what should you do? Well, stop taking those medications, change the dosage, or in any case, consult your doctor. Next, the 7th point, regularly visit your dentist. Dry mouth is almost always accompanied by a bunch of dental problems. Getting or providing timely help for these problems means preventing a lot of serious issues. And also there are products, this is point 8, for moisturizing the mouth. Well, we can call plain water such a product, which you can keep next to you while you sleep at night. There's a standard recommendation to use medical glycerin. Medical glycerin. What should you do? You take medical glycerin and add 3 or 4 drops of glycerin to a liter of water, after which you can use this solution to rinse your mouth. In principle, you can swallow it, but it's not necessary at all. Next, special chewing gums are recommended naturally without sugar. Again, if you search for chewing gum for dry mouth, there are specially recommended chewing gums for these situations. In addition, there are standard recommendations, such as using frozen vegetables or fruits. Usually frozen melon or frozen cucumber is recommended. You just put a piece of frozen melon in your mouth and it really does stimulate increased saliva production. And one more thing. Nowadays, and this is actually very common, there are tablets made from papaya. Papaya contains a substance called papain, and this papain really stimulates saliva production. And so there are tablets made from papaya fruit that really help with dry mouth. Nevertheless, my friends, let me once again sum things up. There are plenty of reasons which a doctor can help you figure out. But the main reason, which no one can help you with, is a warm, dry bedroom and a stuffy nose. Therefore, the most reliable way to combat dry mouth is rinsing your nose with saline solutions and keeping your bedroom clean and cool. So march off to get some saline solution and a humidifier and draw the right conclusions.